Testing. Can you hear me? Kelly, are you there? Okay, thank you. And you can see the full screen, right? The slides. Thank you. Good afternoon, everyone. So thank you for your time and interest in joining this info seminar. For a brief introduction about our master program, Master of Science in Medical Laboratory Science. In abbreviation, this is MSc in MLS. You are interested. Yes, so today it's my pleasure and my honor that on behalf of our department, the Department of Health Technology and Informatics, HTI, we offer this program. And currently, on behalf of our department, I'm the current program leader for this MSc in MLS. You can just call me Dr. Huang Qianling, and I got all my MLS training and education in Taiwan. Yes, but then again, it's my honor to introduce you about this program. Technical problem now, sorry. I cannot go for next slide. Oh, good. So we start about our program aims. Originally, or in this long term, because the MSc program or even the undergraduate program for MLS, we already hold this MLS program for a long time, 20 to 30 years. So originally, our current program aims, one, we like to provide professionals, particularly those they are or you are already work in the medical laboratory science, in the hospitals, in private lab, and any other related discipline in health technology. We like to give a more advanced level of knowledge and skills to help you to develop your professional career. Yes, so as you know, medical laboratory science, including the core disciplines, then I will introduce you the details about the core disciplines, about the subjects of our program. And particularly for this MSc program, we will also highlight one of our newly installed, or in these 5 years, we have a specialism about molecular diagnostics. So for this program, we will also provide you or include the hands-on practice and the knowledge about molecular diagnostics. For our students, for you, if you are interested in the molecular diagnostic field, you may be able to get this specialism, and in the future, you can particularly work in the molecular lab. And for currently, this year particularly, because you see the situation for COVID-19 and other kind of situation, really the manpower less in the hospitals. So this year, we try to provide our second aims. We like to provide professionally oriented training to those graduates, not only in medical laboratory science, but also related health discipline. If you are interested to provide, to develop your expertise in MLS or diagnosis science, we are kind of eager to provide our resources for you to have more training on clinical laboratory technologies. We will provide you more subjects, including in the core discipline for MLS, for you to enter and build the career path. Okay, so that's the aims. So I'd like to, from the beginning, about the introduction. So this program, just like other taught postgraduate MSc program, is self-financed. And full-time, part-time, we have the normal study periods. This just updated this year, 2022, last year. Okay, this year just now, right, January. Last year, we update our normal study period for full-time, 1.5 years, part-time, 3 years. In other words, we also like to provide you a little bit longer time that you can get the subjects. Total 30 credits as normal, maximum 36 as our plan. But then if you can finish earlier, no problem. You can finish always earlier than this normal study period. Full-time, 1.5 years, part-time, 3 years. So we have started our admission procedures this year already. The entrance requirement for this MSc program, because as you know that we focus more on the professional development. So originally we target, you are already the graduate, BSc graduate in either medical laboratory science or biomedical science, and relevant post-qualification working experience in hospitals already in clinical lab is preferable. Yes, because then our program can help you to facilitate your development in the MLS program, in the MLS career, right? So that's the M1. But as mentioned, we also like to help any of you if you are in a related health science or applied science, then we can, this year, we will offer you more choices to facilitate if you like to enter this MLS career path. So about the program structure, so I'm going to talk about the subject, and later I will show you the summary table, and followed by Q&A section. Okay, so for MLS, we have compulsory subjects, but you see the compulsory subjects, 3 credits is related to research method and biostatistics, more basic part. And if we talk about more MLS related, we will call this core subject. And for compulsory one, we have integrated medical laboratory science, totally related to these professionals. But then this subject will be more advanced. We apply kind of problem-based learning. So we will discuss with you more advanced knowledge in MLS and dissertation based on research projects. Later, I will also discuss with you research project. Previously, we have 9 credits as a compulsory, but from this year or afterward, we are thinking about to reduce the workload to 6 credits, but still ongoing. We try to improve our program structure a little bit. So as mentioned, the core subjects, our professors, teachers here, we have the expertise in all the core disciplines, including clinical chemistry, hematology, transfusion science, histopathology and cytology, and medical microbiology. Okay, so the major 4 disciplines. And also we offer the MLS related subjects, including immunology, molecular technology in the clinical laboratory. This all related to molecular diagnostics, including workshops, including clinical application, some practical classes. So you will get the hands-on training in either NGS, digital PCR, nowadays has been implemented in hospital. And also we have some subjects, for example, the elective subjects related to bioinformatics. Now, if we talk about molecular diagnostics, it's getting more and more important, even in the health science or health care industry. Yeah, bioinformatics. And also we have the subject related to professional development in infection control practice. So nowadays, COVID-19, microbiology, infectious disease, very important, right? Okay, so as mentioned, this is the summary. the subject we offered for you to get the required 30 credits, including compulsory, including core subjects, and elective subjects. And as mentioned, we also offer the Master MSc. You have the opportunity to get the specialism. Means on your degree certificate, you will be offered as MSc in Medical Laboratory Science, molecular diagnostics, bracket, molecular diagnostics. And a little bit different structure. For MSc in Medical Laboratory Science, as mentioned, including compulsory subjects, including the dissertation project, we offer the required core subjects related to MLS, including clinical chem, hematology and transfusion science, histopathology, cytology, medical microbiology. Okay, but you can also, if you are already working in the field, you like to get more training on molecular diagnostics, no problem. You can also take these subjects related to molecular diagnostics and bioinformatics. But if you are going to already aim to get the specialism in molecular diagnostics, then these 4 core subjects become compulsory. Yes, although we didn't mention that, right? But then at least you need to pass all these 4 subjects, 12 credits, including bioinformatics, molecular technology in the clinical laboratory, clinical application of molecular diagnosis in healthcare, and workshop of advanced molecular diagnostic technology. Okay, so that's the structure, the program, the subject we are offering. Yeah, one more table just to show you, because in every year, every academic year, we will notice to tell the students, if you are coming as our students, welcome. We will let you know that our program, firstly, as mentioned in the beginning, is self-financed, right? Means that it's a self-paced program. In other words, you design, you select the subjects you are going to take from the list we offered. And one point, self-paced, because some subjects we may offer in alternative year. Just for example, and I highlight here, also want to show you, we also have new subjects. For example, clinical laboratory management is also a recognized MLS subject. Now we all offer it. And then we have lecturers from clinical labs to teach this. And one example just I mentioned, for example, the core subject, clinical chemistry. You see, we offer this year, right, in semester 1. However, next year, we will not offer it again in King Chem, but then we offer medical microbiology, for example. Yes, but then no worries. We will always send the notice to tell the students which subjects you may have the opportunity to select, and then plan well. Even you can finish within 3 years or 1.5 years. Okay, so that's the situation about the subjects. And other minor parts, so you see, because this program under the same postgraduate scheme, so we have other programs in the medical imaging, radiation science, and medical physics. Yes, but don't worry, the subjects we coordinate well. Some subjects that may be open to both students from imaging science and MLS. Yes, then you have this opportunity to select that. Okay, so one more part about dissertation means our student, we highlight, although it's not totally related to professional training, but then a research mindset is very important in any career, I will say. So how you can arrange or organize, lead a project, that would be very important, especially the research project is recognized as a criteria for the promotion in the HA hospitals. So therefore, we have dissertation project. We offer academic supervisor here. I will show you now our academic teachers who can supervise you about the project, but now we are trying to arrange more clinical supervisors. Means some of our master students, or if you are coming, you have the opportunity, you can directly work in your clinical bench. That would be ideal, right? You can work in the project and then that related to your daily job for the career, further help you, yes. And the dissertation, now 3-semester laboratory-based research project, but as mentioned, we try to decrease a little bit the workload. Later, we will have further discussion. And so for research project, as mentioned again, highlight again, is recognize a criteria that whether our students that can be promoted from associate MT to MT, this is required, yes. And we have many supervisors, professors here can supervise the project. Also, we have well-equipped laboratories, including this cell culture, flow cytometry, these are related to hematology and also molecular biology, genomic equipment. So we have NGS, we have Marditov that can offer the training, hands-on experience if you like to work in molecular technology. Someone already raised your question. We can answer it soon. Okay, so I just show you some pictures about the equipment. Marditov, this is the old one. Even now we have a new one. So Marditov mass spectrometry, you know, now is very common, installed in microbiology lab. Digital PCR now is getting more and more common, even in HA hospitals. And NGS, so our department, we have MySeq, more, still high throughput NGS, but more we did more if you learn that our professor, for example, Professor Guillermin Su, very famous now, based on the sequencing for tracing the virus infection, COVID-19 or any bacterial infection. Yes, but we do also have professors. We are doing genetics in human genome for genetic disease. And we have mass array that can detect the variant mutation for the genetic disease, and also confocal microscopy if you are more interested in, for example, in cellular pathology, fish, molecular staining, also fluorescent microscopy as examples. But then the most important, so now our department, MLS program, we have many, particularly many new academic supervisor, either for helping the teaching, more clinical related. So we have clinical associate in the 4 core disciplines. So they are more experienced in clinical lab. So as mentioned, the program, MLS program in PolyU is very long history. Even some of our graduates, they already have 15, 20 years, more than 20 years experience in the 4 disciplines. And our department of HTI, Health Technology and Informatics, the department head, here you can see he's the first graduate here, 30 years experience. Yes, and then including the MLS background, the supervisors or professor with MLS background, clinical associate, we also have now many professor, associate professor, research assistant professor, and also chair professors. Their expertise, they have strong research experience in basic biomedical science and also bioinformatics. Yes, so bioinformatics, again, is one of our future, not long. We will develop bioinformatics part and try to offer more subjects or even new programs in bioinformatics that may be related to our MLS and health science. Okay, so the award requirements. So you can get MSc in medical laboratory science, and as mentioned, we have the specialism in molecular diagnostics. Once you complete the major core subjects, bioinformatics, molecular technology, clinical application, and workshops, and other to fulfill the requirement 30 credits, okay? Then if you have this specialism for your MSc degree, that may satisfy part of the requirements for molecular diagnostic test signatories in the future. Yes, means if you get more experience and if you like to work in the molecular lab discipline, yes, maybe you can be in charge for the signature. And other awards, including genetic award, because we are under the same master, the postgraduate master in health technology. And also, if you are not 10 or you try to not fulfill all the MSc credits, you can still get postgraduate diploma in MLS and health technology. Yeah, but then not many of our graduate got this. And in addition to now well-established program, equipment, and then important, we have professors, clinical associate in the program. One of the kind of unique part is our master programs now is still IBMS accredited. Yes, in the UK by the Institute of Biomedical Science, IBMS. I say now because the situation is previously, some of you may ask, or some of even our students may ask, why I'm working in the professional field, but we still need to perform research projects. I like to say this is one important criteria IBMS request. Means the international standard for a master graduate, we expect you have research mindset, and then it's recognized by HA Hospital and also IBMS. Okay, so that's a brief introduction. And the last slide, I'd like to say that welcome if you are interested in our MLS program. Now we are still opening the kind of application. So we have 4 rounds of selection dates. One, we will have interview Monday, okay, just next Monday. But then if you are interested, you apply and we will check your qualification. And also again, if you are already working in the field, it's preferable, yeah, but then not compulsory for this year. We try to also enroll the student if you are interested to enter the program. Okay, so that's all my introduction. 20 minutes, a little bit short, but then I'd like to welcome all your questions. Maybe before you have question, let me also share our website. If you want to know the details, you can go to our departmental website, Department of Health Technology and Informatics in PolyU. And you can go to the study program, and this is the top postgraduate programs. And you can find out, so Master of Science in Medical Laboratory Science is one of the program. And for this year, we start to enroll. Application deadline, I think, is end of April. But then this year, we do offer the quota. I mean, we will, if after interview, we confirm you are successfully admitted, then we will inform you immediately. Instead of previous year, we wait until late June. Okay, so this year, that's why we opened the 4 rounds of the application. Yes, so you will learn from the website about the entrance year, either full-time or part-time, normal duration, credits required, and also the aims and characteristics for our program I just introduced briefly, and professional development. As mentioned, you can also check, we have teaching laboratory, research laboratory. For example, MLS teaching laboratory. So we have all the required resources, equipment, and also for teaching lab. We have 2 teaching labs, and this is one of demonstration for hematology system. For master program, you may use more research equipment, just like I introduced. So for example, cancer, metabolic disease, all this. And for research facilities, for example, I just show you flow cytometry laboratory. Even our department, we have the updated flow cytometry, and also genome research laboratory, including the NGS, Illumina platform, and nanopore long-read platform. Okay, so you can read more information from our website. Any question? Oh, okay. I found the question and reviewed the question from the chat box. Hong Kong U biochem students apply the course? Sure. As mentioned, this year we open more opportunities for any graduate from related discipline or related program, including biochemistry, biomedical science, or biotechnology. Yes, but then once you are shortlisted in the interview, we will talk to you about our plan. Our plan is, if you aim to enter the MLS program, we suggest you follow our subject structures for full-time program, 1.5 years. That can facilitate. We will try to offer more resources, more time for the required subjects, required courses you need to learn for MLS. I would like to know that if it is necessary to submit a recommendation letter from my employer as a supporting document for application. I will say it will be a bonus for your interview. Once you are shortlisted in the interview, yes, we do see if you have a good recommendation letter from your employer. Yes, means you are working in the field, right? And that will add bonus to your interview assessment. Yes, and then finally, we will rank the candidates from you applicants based on the interview scores. That include we already consider your academic performance, your professional experience. So recommendation letter is one important demonstration about your performance in the field. Any more questions? See if you have more questions, we can stand by 10 or 20 more minutes. If no, then thank you for your time in joining this seminar or brief introduction. Okay, one question from Yuki. May I know, after starting in this program, is it possible to register under Section 12A in MLT board? I like to say, we don't guarantee whether you can register in MLT board because that will be related to all the experience they will consider. They will consider all your experience, all the courses you have taken. So our program, we will try our best for the 1.5 years or 3 years to offer you more opportunity. Oh, 3 years, maybe part-time program, mostly you already working in the field, so you are registered, okay? But then for the full-time program, we try to help you we offer more subjects related to MLS. And we put more time and more resources to help you to for their consideration for registration. Yes, so that is, we can help, but then we don't guarantee whether you can register under 12.1a. Can biochemistry student join this course? Yes, as I answered the question from, the same question from Anson. Sure, yes, this year we consider if you are from the graduate, not from MLS or biomedical science, biochemistry, yes, we will consider. Yes, but then other components, including your academic performance in your BSc degree, and also we will also consider whether you have enough related subjects that can help you for master program. Yes, so biochemistry, yes, is one of the possible candidate with the required knowledge or courses you have taken in the BSc. Typically over is what GPA? Because as you know, we offer the limited quota, right? And then we already received many applicants until January, yes. So I will say higher GPA is better, but the limited, we said at least the better you have the 2.1 for your BSc degree, we will consider. Yes, and the GPA, I will say at least 3 out of 4. Yeah, but then that is only the minimum requirement, but based on, for example, if many applicants, but the quota is limited, we will also consider this is one factor related to academic performance. Final year student, yes, you can apply. Okay, one more question. Can a chemistry graduate apply? You mean your major is chemistry, right? Yes, can be considered, but then as mentioned, we will see we will check the, how do you say, the courses you have taken. Not only one, right? Not only one related, but then, for example, we have clinical chemistry. So chemistry is related, no problem. But the better, you also have some background about biology, about, say, for example, molecular, that kind of, or genetics, human genetics. We will consider your, so we will check your transcripts, in other words, and then consider which courses you have taken. You have the minima, you meet the minima requirement, the basic knowledge you can further successfully enter our program and then finish. Yeah, because if we enroll you, we expect and we really want to help you to successfully finish our program. So typically, can student register the MLT license? As mentioned, the MLT board, they will check the same, just like we check. They will check your overall studies from your undergraduate, your master. Yes, and then again, so we will help you to have more related background for registration. But then we don't guarantee, because as mentioned, it's self-paced. The better you consult our professors or advisors carefully, and you get the required background, required courses for registration. Yes. Environmental lab, but not MLS, will it be very hard to study in the program in part-time? If you are working environmental lab for part-time program, as mentioned, normally previously we got more students from part-time because they are working already in the hospitals, in the chemical lab. Yes, so again, so our courses normally will be offered by clinical doctors, the senior medical technologists, more chemical oriented. So the question is whether you already have the background about some basic knowledge about the chemical laboratory or medical laboratory. That will help you to study. Long-term experience in biolab field only a bonus for the application, or it is important than GPA? Long-term experience, I will say we consider, how can I mention about that? Experience in biolab. Again, we will check whether this is really related to the medical laboratory lab, the MLS. And GPA is related to the academic performance. Yes, so the assessment actually is already separated. Then means you will get different scores in different criteria already. So there's not one important than another one. Okay, any question? Or anything you feel I didn't explain clearly? You like to ask again? No problem, because we still have time, 10 minutes. Then another program, medical physics, will come.
Usually I want to ask so because I'm doing biochemistry, so I just wonder how many coverage biomedical laboratory course is required. So I mean, there is lower list or like a criteria. So how can I tell I have covered enough, let's say elective course? So for example, like I think I have done molecular biology laboratory and also genetic laboratory as well, but I don't know, is it enough?
Okay, so I suggest if you are really interested in our program, you can apply. You directly apply, and then we will check by our experienced professor. So as I show you that some of our professors or clinical associate, they are working in the field, or even some of them, they have experience about review in the MLT board. Yes, when you apply, we will help you. We will help you to check or guide you about this. Yes, you can apply.
And also my second question is like, even though I can register a part 2 from the board, but can I progress to part 1 after like working for several years with my master qualification?
As my understanding, if you are going to register based on if you get more experience and more subjects, if the MLT board allow you to register directly, then you can proceed to part 1. Just my understanding, if your part 2 registration, if that is based on examination, for example, they may reply you, okay, either you have more experience or please go for exam. If that part 2, as I understand, based on exam, you will not be able to proceed to part 1. MLT, but yes, part 1. Yes, but then that part, maybe the better we check our professors here, more experienced colleagues, teachers here, experienced than me about the criteria for MLT board. Yes, I'm only responsible for the program and then coordinate with our department. So we need to confirm with them. Yes, I won't be able to answer the details about the registration. Okay, let me see. How many vacancies in each round of interview? Each round of interview based on, we select the shortlist candidates based on how many applicants. Yeah, because as mentioned, this year we have many rounds, but previously we only have 1 round, right? But so this year, this different round, we will base on, okay, so for example, this round we have 50 applicants, and we may calculate, so around, some of you already passed the criteria, we will invite you for interview, and we will get, for example, 30%, 20%. Finally, we will give the offer. Yeah, based on the applicant. So we won't, for example, if that next round only 10, but we won't put you in low priorities. So don't worry, still based on your criteria, whether you have meet or not. And the final quota, maybe I can only give you the final vacancies. We will enroll part-time this year, 20 something students from the total applicants. And full-time, this year full-time, we aim for 10 quota, 10 vacancies for full-time students. If I did not have much knowledge in MLS field, how can I increase the possibility that can offer me to study in this program? What do you mean? Means you didn't take too many courses for your MLS, for your BIC degree? So Yuki, you want to, yeah. If that is the case, I suggest you can try to see whether previously our more senior professors, our senior colleagues, they will suggest you to try, firstly, can you enter a private lab related to this field? You can get some more experience really related to MLS. Firstly. Secondly, there are some other courses offered by, for example, Hong Kong U Space, or some, as I learned, or Ivy, some associate. If you really like to try it, I suggest you can also consult those programs. Yes, because again, based on our applicants, we And then we provide more advanced training for MLS background. So we do expect you already have the basic knowledge before entering our program. Then you will get successful result, right? Instead of you come and then you suffer it, then that is not what we want. More questions?
Sorry, do this course offer practical experience? I think
Some of the courses we offer practical, but particularly for the molecular diagnostic part, those 2 or 3 subjects, workshops, clinical application, we do offer some practicals. So that's why we mentioned about we have the hands-on training for some advanced technology. Yes, but then for core discipline, as mentioned, mostly for part-time program, you or they are already working in the hospital. Yes, they are doing practical every day already. So for the core discipline, so far we don't offer too many practicals, but then for full-time program, we try to improve your, improve your MLS background for full-time students. If you come from the graduate from related field, we will offer practicals. Yes.
okay, thank you.
If no further question, thank you for joining again. And then as you know, actually we already started the interview. Yes, even from last December, but then we have more rounds. So if you are interested, welcome for applying. And also if you have any question, you can send inquiry to us, to me, or to the department. It's okay. Okay, thank you. Nice weekend. Bye-bye.